School districts are using different strategies now to keep students safe from COVID in the classroom. But some parents are still worried as they drop their children off every day.
Doreen Gensler joins us now from the newsroom with the local mother's concern over nap time for some of the district's youngest students. Doreen, what's this about?
Hi, Leon and Pat. The CDC guidelines say that everyone aged 2 and older should wear a face mask except when they're eating or sleeping. D.C. public schools are following that guideline, but when one mother saw the room her daughter's class was using for nap time, she got concerned with so many unvaccinated students unmasked in a small enclosed room for an extended period of time.
How could you look at an enclosed room where you're going to have 10 to 12 3-year-olds who are unvaccinated with their masks off for 90 minutes and think that that is an acceptable thing to have as part of a school day?
Teresa Westover has been advocating for her daughter's safety since the start of the school year. Her 3-year-old, Audrey, goes to Capitol Hill Montessori at Logan. Westover says she worries about her little girl's risk of catching COVID during nap time, providing us with this video of her daughter's classroom.
They're placing the cots as far apart as they can, and then the kids are sleeping. They alternate head to foot and foot to head.
Westover says she asked if she could pick up Audrey before nap time to take her home for the day, at least until Audrey's eligible for a coronavirus vaccine. But that request was denied.
They told me that if I picked her up before nap, she'd be marked as absent for the whole day. And after so many absences, she would be disenrolled from the school.
The Montessori school's nap room is in between 2 larger mixed-age classrooms, and there aren't any windows. Concerned about the lack of ventilation in here, Westover reached out again, asking if PK3 students could use empty, bigger classrooms as nap rooms so that doors and windows could be open for air circulation and the kids could have a better chance of social distancing. But that request was denied, too, and she wasn't allowed to opt her daughter out of nap time either.
The only solution that they agreed to was the one that made Audrey responsible for her own health, which was to wake her up in the middle of nap, in the nap room, anytime she fell asleep, so that she could continue to keep her mask on.
Dr. James Campbell is a professor of pediatrics at the University of Maryland Medical School. He says he understands the concern from parents and says each school district should be weighing the risks and benefits when enacting policies to keep children safe and in the classroom when possible.
If you have distance and some ventilation, the risk is lower. They're not breathing heavily usually when they're asleep, so it's light breathing, so it's not as likely that they're getting the virus, if they were asymptomatically infected.
News 4 reached out to DCPS for comment. They declined our request for an interview, but instead issued a statement saying mats and cots are placed at least 6 feet apart during nap time. Or, if there's not enough space, they place children head to toe to ensure that their faces are at least 6 feet apart. Out of options and in fear of having her daughter disenrolled from school, Westover ended up buying an air purifier for the nap room to try and make it as safe as DCPS would allow, but says she's sharing her story in hopes of creating change.
I was really disappointed when I thought I had offered a number of solutions to DCPS that wouldn't cost them any money to make this safer for these kids to nap or to either come home for nap. We know what we know about COVID and how it spreads, and we've been dealing with this for 18 or 19 months at this point.
Teresa Westover says she's willing to have her daughter home for nap time, and she feels that if more parents were given that option, there would be fewer children in the classroom, making it much easier to social distance for the ones that remain. She calls it a temporary fix until her 3-year-old is eligible for the vaccine. For now, DCPS is not changing its policy. But
wow.
Pat and Leon, that's just one example of some of the varied concerns that parents have about their children back in the classroom, especially the youngest children who don't have the option to get the vaccine.
Yeah, and the links that parents are willing to go to make sure their kids are safe and they've got peace of mind. Going in their own pocket and buying equipment. Boy. All right. Thank you, Doreen. Now we turn